If you or your spouse decide to keep working past 65, how will you start your Medicare at a later date without any penalties or problems? In this video, I'll show you exactly how to do it. Now, to understand this particular subject well, there's actually 6 items that I'm going to cover in this video. Number one is this. There's actually 2 methods of Medicare enrollment. In other words, there's 2 ways in which you're going to get into the Medicare system. Number one, there are people that are automatically enrolled into Medicare. There's nothing they have to do. The Medicare card is going to show up in the mail. And that's for anyone that is receiving Social Security benefits. So whether you're receiving retirement benefits or spousal benefits or survivor benefits, you will be mailed your Medicare card actually 100 days prior to your birth month. It always comes right about 3 months and a few extra couple weeks before you actually turn 65. So if you're receiving Social Security, nothing you have to do, you're going to be automatically enrolled into Medicare. Now, many of you are not yet on Social Security benefits, so you're going to have to use the second method, which means you have to actually self-enroll. You'll not be automatically enrolled. You have to initiate that at the right time if you're going to start your Social Security benefits. All right, so that's the 2 ways in which we take Medicare, either auto-enrolled or self-enrolled. I'll explain the details exactly when that you would need to do that. Now, the second item that we have to understand are the actual enrollment periods, the time in which we actually can enroll in a Medicare, because we want to go on Medicare at the right time. So the first option is to enroll in Medicare in what we call your initial enrollment period. And this is the enrollment period that anyone that is going to start Medicare at 65 is going to use. Now, if you're watching this video, you probably are not going to use this one, but you need to understand that there are some people that have to go on Medicare at 65. And there's actually 5 groups of people. Number one, anyone that's actually covered by a retirement plan has to start at 65. Anyone covered by a marketplace plan, the Affordable Care Act plan, they have that individual plan they got through the healthcare exchange, they have to start at 65. Anyone that is on TRICARE, which means retired from the military, you have to go on Medicare at 65 because TRICARE only pays second to Medicare. Anyone that's on a COBRA plan, either they or their spouses covered by COBRA, got to start Medicare at 65 because COBRA only pays second to Medicare once you're eligible. And then lastly, anyone, and here's the key, if you or your spouse are still working and there's 19 employees or less at that company, you actually have to go on Medicare at 65. Okay, so there are people that must go on at 65. If they're on Social Security, automatic enrolled. If they're not, they're going to have to self-enroll. So that's one enrollment period. Now, the one that primarily those of you watching this are going to have to use is called the SEP. And this SEP actually stands for a special enrollment period. And this is for people that didn't go on Medicare at 65. Why is that? Because they or their spouse were working and covered by an employer-provided plan that has 20 employees or more in it. That's the cutoff. And so if your company has 1,000 or 200 or whatever, anything above 20, you do not have to do anything with Medicare at 65. You just don't have to. Now, there's people to tell you have to, but you really do not, and there'll be no penalties, no problems. But that's the cutoff. 20 or more employees, then you're going to come into Medicare using what's called the special enrollment period. And here in just a minute, I'm going to explain the details of that. But first, I want to do the overview of the different enrollment options. The last one is called the GEP. Now, this stands for General Enrollment Period. Folks, this is the one you don't want to have to use because anyone who is using this one has actually made a mistake. What happens is they miss this one or they miss that one, and now they're stuck with the GEP. And I'm going to tell you why that is a bad option as we delve into the details of these 3 Medicare enrollment options. All right, then brings us then to item number 3, and we're going to talk about the time period in the process for that initial enrollment period. Remember what this is for. This is for anyone that has to start Medicare at 65. And that would be, as I said earlier, anyone that's covered by retirement plan, anyone that's covered by an ACA plan, anyone that's on COBRA insurance, they or their spouses at 65, anyone that is on TRICARE for life, retired from the military, or anyone that is covered by a plan where the employer is 19 or less, meaning 19 employees or less, you've got to go on Medicare at 65. All right, and so we know that if we're going to start at 65, the way that we're eligible for Medicare is this. We had to have paid into the Medicare tax system 40 quarters, which is 10 years worth of work. And so regardless of whatever enrollment period you're going to use, the IEP, the SEP that we'll talk about next, or the GEP, this is how we qualify. Now, most people have 10 years worth of work. They paid into Medicare taxes. Those are called FICA taxes or self-employment taxes. Most people have their own 10 years. But if you don't have your own 10, you can get those either from an existing spouse, as long as they're at least 62 and they have 40 quarters. You can draw from them. Your marriage had to last for 1 year or longer. If you're going to draw those from a previous spouse, someone you were married to before, as long as the marriage lasted 10 years, there was no remarriage prior to the age of 60, you actually can draw benefits off of that previous spouse. And again, they have to be eligible for Social Security. You don't have to be taking, just have to be eligible. All right? Now, if you're going to draw from a deceased spouse, as long as the marriage lasted for 9 months or longer, you did not remarry prior to the age of 60, then you can draw benefits off of that deceased spouse. And so the point is, we're always looking for 40 quarters, either yours or someone else that you can draw from their work record. All right, so we're saying here, this is someone that has to start at 65. We talked about those groups of people. And so the time period revolves around someone's 65th birth month. So let's just say that someone was born July 4th, 1958. All right, and they're turning 65 this year. I'm shooting this video in June of 2023. And so right now, this is someone that's eligible for Medicare. They have their own 40 quarters. So the way they would do this, now keep in mind, folks, if they're on Social Security, they'll automatically be enrolled into Medicare. But if they're not, they have to self-enroll, and this time period shows them when they need to do it. So what we have is we have a 7-month period called their IEP. So we have 7 months to enroll during the initial enrollment period. Those 7 months are our birth month, or 3 months before, or 3 months after. So in this example, someone again born July 4, 1958 could start their Medicare A and B 7/1/2023. So the 3 months before would be back to April, and the 3 months after would be as late as October. And so when we enroll during these 7 months determines when our Medicare is going to begin. And so if I enroll the first 3 months before, my Medicare is going to begin July 1, my birth month. Now, remember this, if your birthday was July 1st, this whole calendar would actually move forward 1 month. So if you're born on the 1st, they always start you the previous month, okay? So we have 3 months before. If we enroll, we'll start our birth month. But if I wait for whatever reason, and my birth month is July, and I enroll in July, my coverage will start in August. If I enroll in August, they'll start me in September. If I enroll in September, they'll start me in October. And if I enroll the very last month of my IEP, then my coverage then would start 11/1/2023. So the whole point is they're going to put you off for 1 month. So if we have to start at 65, this is when we have to do it during this 7-month window. And so the process is this. As long as we have 40 quarters, what you would do is you would set up what's called a myssa.gov account. Many of you have those. If you don't, it takes about 10 minutes to do it. And then after that, you can actually go online and you can enroll into Medicare A and B online. It's a very simple process. If you have a problem with that, then you can always call local Social Security office and set up an appointment by phone to enroll into Medicare. So that's the process for anyone starting at 65. Now let's look at those who are going to start at a later date, 67 or 72, and you're going to come into Medicare at a later date because you or your spouse were still working and you were covered by a group plan that had 20 employees or more. Let's look at that. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. And so we're eligible to use the special enrollment period as long as we were covered by a group plan of ours or our spouses, and there was 20 employees or more. We didn't have to do anything during the initial enrollment period, but now we're saying that we're going to lose that plan either because it's no longer a good plan or actually going to retire. And so again, same thing applies. If I'm going to come into Medicare, I still have to have 40 quarters. That means that I paid into Medicare taxes for at least, 10 years or more. And again, if you don't have your own 10 years of work, you could draw that from an existing spouse, a deceased spouse, or even an ex-spouse, depending upon the rules, as long as you did not remarry prior to the age of 60 for an ex-spouse. So the whole point is this. This enrollment period is different, and this enrollment period is for those who didn't start at 65. And so the process is this. Again, you need to have an SSA.gov account. You can set that up. Again, 10 minutes, doesn't take very long at all. It's very valuable to have one of those for Medicare, but also for Social Security purposes. And then what we're going to do is we can enroll online into Medicare. So we actually can start the process online. But here's where the SEP is different than the IEP. The IEP, I just had to have 40 quarters. I can do everything online. Not so with the SEP. So what happens is this. We actually have added 2 documents to the process. 2 documents. All right? And so what we have to do with these documents is, number one, we have to prove that we have had credible coverage back to 65. So let's look at my example I looked at earlier. We said someone had a date of birth of 7/4/1958. Now, they could have started their Medicare 7/1/2023, but they chose not to. Why? Because their spouse still working, had a group plan of 20 or more employees with that company, and it was a good option for them. Medicare was not the best option. And so they could have started here, but they didn't. So now let's just say they're going to work for 2 more years. And what they really would like to do is they want to start their Medicare 7/1/2025. So in this scenario, this person is now what? They're 67 years old. And what we have to do in the special enrollment process is we have to go back to age 65, and we have to prove that they have had credible insurance coverage. They're their spouses, there was active employment, and there was a health insurance plan at work. So we have to go back to 65 with no gaps in coverage whatsoever. Now remember, it could be you or your spouse, so it doesn't matter. We've got to go back here. Now you could have been with that company for 30 years or 40 years, doesn't matter. The form that we're going to have filled out has to verify at least back to your 65th birth month. Now, the form that we use is called an L564. L564. It's a 1-page form. On it, there's actually 3 parts. Part A is the part that you would fill out, or you work with us, we'll do it for you. And this would be your name, your Social Security number, your home address, those kinds of things, and the employer that you have. This next section is actually filled out by your employer. That's typically the HR department or someone who had access to your employment records. And then the last part is they'll fill it out, but then they also have to sign it and date it. And so what's going to happen is they're filling out the L564, proving we have credible coverage back to 65. Now, occasionally we'll have people that will actually change jobs. They're working at 65 with one employer, and let's say at age 66 they change employers. And so what we had, instead of having one L564, now we have 2. I've had as many as 4 before we had to verify, but I got to verify employment insurance all the way back to 65, regardless of how many employers you may have had during that time. Keep in mind, if you don't start at 65 and you're going to keep working, never have a gap in your insurance at all. And COBRA would not be considered credible. It's got to be active employment. I've had people that were going to be in transition without insurance for a month or 2 that called me and said, Marvin, what do I do? Well, here's what you do. You go on Medicare A and B, and then you can always drop the B part of Medicare if you pick up an employer plan. That's a good option for you, but you do not want to have any gaps from 65 on. So the L564 will prove that. The second form we're going to use, and this is called a CMS 40B form. And what that form does is it actually allows us to tell Medicare when we want to start our coverage. So in my example here, we're saying that our employment and insurance at work is going to end June 30th of 2025. So on the CMS 40B form, we actually would tell them, please begin my Medicare effective 7/1/2025. So the L564 proves that we're eligible, no penalties, no problems, and the 40B tells them when we want to start our Medicare plan. All right, so the point is these 2 forms are added to the process. You didn't have to have a 40B or an L564 in that initial enrollment period, but if we're going to start after 65, both of these are going to be necessary. This is also very important. These 2 forms that we're going to do, folks, you'll never do those any sooner than 90 days prior to when you want your coverage to begin. You're not going to do these 4, 5, 6 months in advance at all. The government does not want them. So the right time period is about 90 days. You can even do it in 30 days, but really the sooner the better. People ask me all the time, Marvin, when do I contact you to do this? 60 to 90 days prior to losing that group plan, prior to when you want to start your Medicare. This is when you need to start the process of the L564 and the 40B. So this is what we'll use coming in using that special enrollment period. All right, that brings us then to the fifth item that we're going to discuss in this video. And I'm not going to spend a lot of time on it other than I want to make you aware of it as we talk about enrolling into Medicare. This is called the general enrollment period. As I said in my introduction, this is one that you really don't want to have to use. This is for people that made a mistake. They missed the IEP. They missed the SEP. And the reason we don't want to use this is really twofold. Number one, you can only enroll into Medicare using a GEP from January 1 to March 31st. Of every year. That's it. So we have a 3-month window. So if a person realized they made a mistake and it's April, there's nothing they can do. They're going to have to wait till the next year and enroll the first quarter. Now, whenever we do an enrollment in January, my Medicare starts in February. I do an enrollment in February using GEP, starts in March. Do it in March, starts in April. And so they'll start you the very next month. But the problem is we only have 3 months to enroll during the GEP. The second issue would be this, and that would be there's very likely a penalty that's going to be assessed. Medicare says this: for every 12 months that you go without Medicare when you should have had it, then you will be assessed a 10% penalty on your Medicare Part B. And that penalty, folks, is for life. So if someone goes without 24 months, they have a 20% penalty added to their Part B premium for the rest of their life. And that's why I'm saying we do not want to use the GEP. Hey, if you're finding this video helpful, I want to invite you to go right up here and actually click on a link that will allow you to watch what I call the Medicare Essentials Workshop. It's a workshop that I did that really is going to show you everything you need to know about Medicare from A to Z, how to enroll, when to enroll, and the plan options for you. So go to that link and check it out. All right, that brings us into the sixth and final item that we need to address in this video, and that's this: special considerations. There's some confusion for people that often will not take it 65 and they want to take it at a later date. Is there anything they have to do? And so let me clear up the confusion. Number one, you will hear people tell you that if you decide not to go on Medicare at 65, you still have to enroll in Medicare A. That would be called A only. Now, folks, that is not true. If Medicare A is free for you, meaning zero premium for you, meaning you or your spouse has paid in that system for 40 quarters and you're eligible for premium-free Medicare A, there is never a penalty. And that is basically 99% of all people, okay? And so the only people that ever have to pay a penalty for Medicare A are those that have to buy Medicare A, which means they didn't have 40 quarters. They do receive a penalty if they don't start it at 65 or when they retire. But if you're going to get Medicare A premium-free, 40 quarters, 10 years of work, yours or your spouse's, you will never be penalized for Medicare. You can actually start Medicare A anytime that you would like to. Okay, and so we're talking about, do you have to have A only? And the answer is no. Now, the reason I'm teaching this is because there are people right now that are still working that have a high deductible health plan at work. And with that high deductible health plan has attached to it what's called an HSA, or a health savings account. And so if this is you, your scenario, high deductible HSA, you're contributing to that. This year you can actually contribute $3,850 a year plus a $1,000 catch-up if you're over 55. And so that's $4,850 that someone could put into their HSA. But if you enroll in A only because you were misinformed, you can no longer put new money into your HSA. Now, the HSA account is yours, but you cannot continue funding that. And that's why I'm saying to you, if you have a good group plan and you do have an HSA because you're high deductible, then I would not do anything at all with A. I wouldn't do A only, and you'll not be penalized. Now, if you don't have an HSA as an option, it's fine to enroll in A only. Keep this in mind, though. If that group plan has 20 or more people in it, then what happens is when it comes to claims, your company plan is going to pay first. And then Medicare A is going to pay second. And again, they may pay something. I can tell you this, they'll not pay co-pays and they will not pay any deductibles, but they will pay co-insurance. So if you did have a hospitalization, you were responsible for co-insurance, Medicare A could help with some of that, all right? And so it's fine to enroll in A only as long as you don't have that HSA. But again, the payer companies first, Medicare is going to be second. All right, and so that's one special consideration. Do you have to enroll into Medicare A only? And the answer is no, you don't. If you do, it's fine. Just no new money going into an HSA. Now, the second consideration is for those of you that are still working, your spouse is, and you're covered by a group plan that really is not very attractive. It's just not a good group plan, meaning the premium's high, the deductible's high, the max out of pocket is high, and that's really not a very good plan. Well, if you're approaching 65 and you're still going to keep working and it still has 20 or more people in the group, you do not have to stay on the group plan. You have what's called a life-changing event. So some of you may want to go ahead and start your Medicare at 65 and just simply say no to the group plan and say yes to Medicare. You have the right to do that. Now, let's say that you're 66 or 67 and now you decide, I don't like my group plan, but I'm going to keep working. Well, then the company has every right to say to you that you can't go on Medicare just anytime you want. They can allow you to go on Medicare during your company's open enrollment season. And now some companies will let you go anytime, but some companies will not. They'll just simply let you go during the open enrollment season. But at 65, if your group plan is not a good as option as what your Medicare is, you absolutely can start your Medicare at 65 on your birth month during that what I call the initial enrollment period. All right, so that's another consideration. So what you do is you just simply do a comparison. Look at the group plan, look at your Medicare options. So the group plan, what's it cost you for premium? My rule of thumb is if you're paying less than $200 a month, it's probably a better option. But if you're paying $200, $250, $300 a month for your plan and has a high deductible, then Medicare probably is going to be a better option for you. But just simply compare those. Look at the premium, look at the deductible, the max out of pocket, your medication coverage, and compare those two options, lay them side by side and see which one makes sense. And so if Medicare makes sense while you're still working, you can go on Medicare and drop the group plan. So that's a very important special consideration. All right, and then lastly, if you decide to stay on the group plan because it makes sense financially for you to do that, eventually you're going to retire and come off the group plan. And again, we're going to go through that special enrollment process, the L564, the CMS 40B, submit all that to the local office to prove that you're eligible, no penalties and no problems. The question is, when do you do that? Again, I said earlier, you're not going to do that 6 months in advance. The perfect time is about 60 to 90 days prior to losing that group plan. That's when you need to get serious about shopping, about planning, getting all the paperwork all set up. And so make sure that you transition very seamlessly, very smoothly off the group plan and go on to Medicare. So many of you, in fact, statistically about half of you today are going to actually use this special enrollment period. And you want to be sure that you go through that process with someone who's going to kind of hold your hand through all that, get all the paperwork done, and do it in a very timely fashion.